Dear participants, this event is a first time ever event.
During the pandemic, we've become familiar with the challenges faced by the healthcare system, but social services have also faced significant issues to provide care and support for the most vulnerable in our societies.
We see that service providers and professionals are very well represented, and it's good to see that we also have some media and academics amongst us. Very good.
COVID-19 has exposed a long-standing problem in care provision in the EU.
Social services are under particular strain, and the Commission is committed to help.
The corona crisis is a stress test for the actual resilience of our societies. It is a stress test for the resilience of our social services in particular, and a stress test for the real significance of the European pillar of social rights.
Dear participants, it is now time to listen to those that can bring in grassroots realities.
The other big problem was the financial situation, because if the service is closed, the people, the staff of the service cannot get the money because they are not paid for the service which is not provided.
We really tried also to take care of our team in this difficult time so they can take care properly of everybody else.
But the big challenge for the elderly care sector has been that although a national ban on visiting nursing homes were introduced quite early on, sadly the virus still made its way into the care homes.
But our people in Slezska Diakonia, they were during the whole period close to the clients, so we were really in direct care in the front line.
Suddenly, homeless people did not have access to hygiene, nor to food.
So corona crisis is like a magnifying glass. Loneliness, mentally and physical diseases, addiction, poverty, all have been more obvious to the people affected in Denmark.
In Spain, like in several other European countries, children and youngsters were forgotten during the first months.
The traditional way to provide support had to change overnight.
And what we call for as social services providers, we call for an urgent creation of European Emergency Fund for social services.
It's important to say it again. Social services are key partners of the European Union.
Many of our members have been in the front line, often unprotected, in dangerous circumstances to themselves, to the elderly, the sick, those we care for.
You are the heroes, and many thanks for your dedication and effort.
Dear participants, you took part in something exceptional.
And today we have heard what actually needs to be done.
Let's work together and let's make the European Union an even better place to live.